Hi, my name is Jackie Short. I'm the Clinical Director of Sydney Centre for Creative Change, and I'd like to welcome you to our fourth Holding Space webinar, Music for Wellness. Good morning, everybody, and welcome to our webinar this morning. It's lovely to see all your lovely faces and to welcome you into our fourth episode for Holding Space. This is a webinar that we run free each week, and today I'm very excited because we've got two special guests with us, two music therapists from Australia who live in Brisbane, and they're going to be doing a guest presentation on using music for wellness and to support self and others. So I'm really looking forward to their presentation today and to sharing their insights with you. So welcome everybody. I know some of you have attended many of our webinars to date, which is lovely. We also have an opportunity to communicate through our chat box, and we've already put a few messages in there. So could I ask you to go to that chat box now and just share what you're most looking forward to this morning. So of what we've got planned for you this morning, a chance to connect in with some others, a chance to have a game, an activity later on and win some prizes, to hear from two wonderful music therapists about music methods and how you can use those. And also I'm going to do some reflection on protective factors. So an opportunity to reflect on challenge and what can come out of challenge for us. So that's what we've got in store for you today. What are you most looking forward to, or what are you most here for today? You could just type that into the chat room, and I'll get Aidan, who is you're going to see in a moment, just to read out some of those comments for us. Aidan's our beautiful admin person, and he's going to read out some of the hopes there. What are some of those messages that are coming through there, Aidan?
We've got Annette, she's looking to be invigorated. Jay Anderson, connecting with others and learning. Being creative and learning new practical ideas. Music and creativity and how it can promote wellness. And a nurturing experience as well as ideas. Fantastic.
So thank you for typing those thoughts and hopes in. I'm hoping we can achieve those goals and hopes today as we spend this time together. This session is being recorded. I'll edit it and I'll put it up like the other three sessions that we've had available for you and for others on the website, probably in a week's time. And okay, just to let you know technically as well, if when you go into the chat rooms, some people find that if their internet isn't great, they might fall out of the meeting altogether. So if you do happen to drop out, just know that you can log in again at any time in this 90 minutes using that same login code. I'd just like to run through very briefly what our plan is for today, and we'll get started. So as I mentioned, this is the fourth in our Holding Space for Self and Others series, and today our focus is on music for wellness. Our special guests today are two registered music therapists in Australia, Dr. Jeanette, Kennelly and Tanya Balil. They're going to be sharing their experiences of being in lockdown, as well as what they know works for themselves and for the others that they work with. And I'll introduce those in a little bit later on. The protective factors, I think, is an interesting concept to consider both for ourselves and others in our immediate worlds, our family, our friends, and any of the clients that we might be, or students that we might be supporting at this time. It's a really good strategic way from the strength-based approach to do some reflective work personally, and from those reflections to draw out our qualities, strengths and capacities that we know have helped us in the past and can help us in this time of challenge as well. We're going to have two opportunities to connect in with small groups today, one straight after the presentation from the music therapists and one toward the end of today as well. And then we're going to finish with some prize giveaways. You can win a free webinar from our training repertoire, and you can also win a free singing or music lesson online with a fabulous music teacher. So that's what we're going to be looking at today. So I'd like to start with, we're going to do this the other way around, start with introducing Dr. Jeanette Kennelly. Jeanette is a beautiful person. She's been working in our team for about 1.5 years now, and she and Tanya run a creative arts supervision program in Brisbane. And she's been working with both children in paediatric settings and adults in cancer recovery settings. She's been a teacher at universities, and she's now working in private practice as well. So she's got a wealth of experience, and I'd like to welcome you very warmly, Jeanette, and hear from you today. So just stop this and focus on you. So welcome, Jeanette.
Thank you, Jackie, and thank you everyone else. Can I gather I'm being heard okay and don't need to adjust any settings?
No, all good.
Great, good, wonderful to have this opportunity to be able to speak to everyone today, and especially, of course, to do this with my beautiful colleague Tanya.
Yeah, lovely. I know you work very closely together and have a very special working and professional and personal relationship. Jeanette, how long have you been in lockdown, and what have been some of the challenges that you've faced personally and professionally?
Well, so probably in lockdown in terms of some parts of my work, and also personally too, I suppose, for the last 4 weeks, six weeks now. So it's been a really interesting time. It's had its quite revealing moments of personal challenges. I think that I've come to realise about what it means to not be able to connect face to face with people, especially with the kind of work that that I do, both in the hospital setting and also in a GP practice. So and then of course personally, just with family relationships, with tending for a parent who has to be isolated, not elderly parent, and negotiating that, and it's it's called on all reserves. Let's put it that way to keep going.
What have been some of the opportunities or wins that you've found out of this time of challenge?
So look, there have been lots of them, and which has really surprised me. I think personally having and being able to have that lockdown family time with a family of 4 of us, and where we've come to, I think, to know each other. We're a very well connected family, and to come to know each other on a very on a deeper kind of level, because we're all in there together. I mean, my husband and I are still able to go out to work because of the work that we're doing in our in healthcare. So we're part of that essential workers group. But look, in terms of connections, deeper connections, I think personally with family members, and work-wise, the opportunities that you probably have once considered, different ways of using music therapy, it's endless. And I think what your brain just starts to hurt a little bit because you're constantly having to think and rethink and reevaluate what you're doing. But the opportunities are incredible, especially in relation to doing telehealth sessions and online music therapy groups.
Can you tell us a little bit more about what applications you've been able to use from a music perspective? And I mean, you're registered and a very trained and experienced music therapist. You've had more than 25 years experience in this field. The group that we have with us today and the group that might be listening to this afterwards are predominantly mental health professionals, but also a bigger group of helpers, teachers and others who work with clients, students in a variety of different ways. What are some practical ways that you think music can be used in an online format more broadly to help?
So I think we've seen in the last month on social media the ways that music has been used to form those connections and maintain connections with one another, whether that's with family members. There was a recent post about a grandparent, it was a grandmother whose daughter wrote a song to help connect grandchildren and grandparents together, and they shared that experience. And for those, I think it was 4 grandchildren, to be able to see their grandmother and sing that song to her, and she sang it to them, it was a way of maintaining those bonds, the bonds and connections that are important. So things like songwriting, song sharing, and music listening. We all know that music can have an incredible effect on our moods and our feelings, and we can create playlists to assist those types of areas as well too. So whether we're creating songs, there's been so many song parodies. So when I say song parodies, that where people have taken songs that are already well known and changed around the words, and usually with some type of COVID message in there. Some of them are really well done, some of them are really interesting, but you can't help it, either really smile and engage with it, or just think how ridiculous that song sounds. But it changes our mood, and singing does that. Singing, whether we're singing on our own, whether we're singing as a group, pub choir, which has become couch choir now, watching all of those people get online, do their recordings, upload their recordings, and be able to hear themselves singing with others. It's community building. And there's lots of opportunities out there. So it's been beautiful to see that happen.
Yeah, they're great reflections. Have you come across a favourite parody on any of the forums you're on?
Ooh. Well, actually, probably the favourite one at the moment has been the Every Little Cell. I think some people would have seen that on social media. The every little cell in my body is happy, every little cell in my body is well. That song. So it's based on an old American folk tune, I think. And a music therapist, Alison Davies in Tasmania, has had a lot of publicity around her use of this song in her practice. So yeah, it's a good one.
That's lovely. Thanks, Jeanette. I really appreciate it. We might introduce Tanya now, and then come back and collectively answer some questions. If I could just ask, we've got a few people just joining us now. Welcome, Tina and Jennifer. If I could just get you to keep your mics on mute so we can maintain the great sound, and great to see your cameras on too. Thank you. So Tanya, welcome. Tanya is not only a registered music therapist, she's also a registered creative arts therapist. So I know, Tanya, for you, it's not just music that's important, it's also being able to integrate other forms of creative arts in the counselling, in the therapy, in the teaching work that I know you do. And you're also a musician in your own right, and we can see some of your beautiful instruments behind you. Can you tell us what have been some of the challenges and opportunities for you during this time?
Well, thank you. First of all, thank you for inviting me to be part of this webinar and to have another opportunity to present alongside with Jeanette, which is always a treat. Look, it's been an interesting time, and I think it's been the case for everybody that's attending this webinar, because I find that we need to reinvent ourselves. When we rely, it's almost like losing a sense or gaining a new sense. Yeah, it's well known that when people lose their sight, they develop their ears or their different senses, right? So it's almost like when something is taken away, then we need some time for readjusting, but then all this new potential comes in. And this is what I have been experiencing. At first, it was a bit of like a shock, like what am I going to do? How am I going to translate the hands-on, face-to-face, because my work is very experiential. It's very, there's materials and sensory base, very much so. So it was the question, how am I going to replicate that through a screen and through an online platform? I felt really challenged by that. However, different things have happened since then. Like for the first thing, well, Jeanette has spoken about this song that Alison Davies made, and I heard it and I was inspired by that. I said, I'm going to make a little song for the kids in my school. So I created a little song that I'd like to play a little snippet of it for you to have a listen. And that actually opened a whole new platform of sharing and engaging with the kids in the school. Maybe before I go any further, I may do that. I may share with you the song. So if I may just share the screen here. There we go. I hope you can hear that.
Hey guys, are you ready to rock with the lockdown world?
Yeah, I'm pretty cool.
Well, let's get rocking then.
Okay.
When in lockdown, I wanna see if there's anyone to sing with me to break the lockdown world. Break the lockdown world. When I sing, my wings fly free. I want to see if you join me to break the lockdown world.
forward a little. Sorry.
That's beautiful, Tanya.
Cool. Hey, hey, you guys, take care of yourselves, okay? In this lockdown. No, John? Yeah, sure, take care. Hey, Tanya?
Yeah, shall do.
Yeah, okay. That was it. Margarita, oh, give us a kiss.
So anyway, I just wanted to show you this because look, I'll just stop sharing. This gave birth to these two characters, Jeff and Margarita. And they're two puppets that we had in the cat room, the creative arts therapy room, where I work at the school in Logan in South Brisbane. And from that, it grew a whole new a series of videos that I've been putting together, creating songs. And then I've taken Jeff and Margarita to my house, and they're kind of involved in everything that I do during lockdown. So I'm taking them over to the garden, or we've been renovating the bathroom. So they've been sort of drilling and making things, putting the IKEA furniture together. So involving those puppets and making songs to go with all these activities. And all of these are becoming videos that I'm going to be putting together and sending over to the kids through the platform that they're doing their online schooling. So I found that was a way of me. I wasn't able to provide the one-on-one that we do in the creative arts therapy room, but I was still able to engage in a fun, creative, meaningful way, I think, with all the kids in the school. So instead of just doing one-on-one with the selected sort of more troubled kids, I was able to do something that was for the whole of the school community. Now, this is a whole different scope that we had never explored before, and it's come through this moment through this challenge of how to reinvent ourselves. So I just wanted to share this with you because it may prompt ideas of how we can how we can use the resources that we have in a different way.
Thanks, Tanya. It's lovely to hear what opportunity you've had grown out of this challenging time. And I think, and I know we've spoken already about this, that this initiative and this great idea that is going to be helping children who might not otherwise have had that contact from you, it's also going to be able to potentially be used after lockdown. So these are opportunities that we're growing and incubating in some way in this space. Exactly. This creative time potentially, and we're not all necessarily able to access that, but there are some opportunities here. Is there any advice you'd give others about using music or using creative arts that could possibly help in their environments?
Look, I've been thinking a lot about this, and the use of music is a very personal thing. Every one of us has got their own relationship to music, their own history. So that is reflected very much so in the playlist that people make for themselves. Some people don't even make playlists, and they like just receiving the random music that the world or life around them brings to them. Some others want to select the music they listen to. These are moments for us to reflect upon this, like. Do I want to continue listening to the music that I've been listening all the while, or do I want to be a bit experimental and go and look for other music that I haven't been exposed to before? Or maybe just, when you go on YouTube, sometimes you just go in tangents. You end up in places that you didn't expect, and some of these sort of tangents take you to incredible places that you get to discover new worlds in music. I think sometimes it's easy for us to get locked in one particular form, and these are moments that we can give ourselves opportunities to expand and to find different ways. Some people decide to use this time to learn an instrument, or to up skills themselves, the things that they already know how to do. They can just train themselves a little bit better. Some people that are musicians may decide not to do music at all and do something else, like gardening. Some other people that have never had music in their agenda may want to take it on. So it's a very personal thing. It's hard to give advice I think everybody has to tap in, but just definitely the music has got a very powerful way of evoking emotions and of engaging with the world. And if it's great if that can be included in what we do somehow. Well, Jeanette has already told you a lot of things: songwriting, song parodying. The one thing that I have explored with doing things through telehealth, through online platforms, is that sharing music from my side to their side can be a little bit tricky with the sound of it or whatever. It always feels like it's easier if everything is on the net. Like if you upload something on YouTube and then you send the link and the other person listens to it from the other side. That's if you want to share music. Things that could be explored are like in the same way that you have book clubs, you could make music clubs, and then everybody suggests a particular song that they like to sing or to listen to, and then they get to analyze or decide why or share what is it about that song in particular that they like, we could just be creative with how we engage with that, not only with ourselves, but also with our community. And I'm not sure if this has been your case, but in my case, my family's in Spain, and I don't think I've ever been as connected with them as in this time that they're in lockdown, because all the families coming together with this Zoom platform, and every day we're connecting, which was never the case. And music can be a way of connecting. Sometimes we get to do a lot of chatter, a lot of, talking about things, but suddenly we could just say, hey, by the way, I've listened to this song. And then suddenly the conversation just goes into a whole different realm that I think is very welcome every time it happens. I don't know, things like that could work.
Yeah, wonderful. Thanks, Tanya. Thanks for sharing those practical examples of how we can use music for ourselves and others, and also some of the technical challenges when we're using these platforms. The sound is not going to be the same, and there's issues of lag and a frequency that we need to take into account. So that's a great suggestion if you want to share music, to actually share a link so people can open it themselves so you don't have some of those problems. I think we might go to some questions now, because I know Jeanette and Tanya have some other things to do today as well. And hopefully they can stay with us a little bit longer to field some questions. But this is an opportunity now, if you have any questions for Jeanette or Tanya, to put them into the chat box and I'll read them out and they can answer them. So anything specifically you'd like to know, please don't identify any individual clients, but if you want to have more general questions, I'm sure they're happy to answer those for you. So just there in the chat box if you wanted to put any in, if anyone has any. And then we'll move into some small groups after we do that. So we've had some chat coming through there before.
Can I make a suggestion what questions are coming in?
Sure, yes.
As a music therapist, there's been a lot of questions in our community of music therapists of how to maximize the use of the computer settings, so for music to come out at its best. And there are a lot of YouTube links, like Zoom gives you an automatic default setting, which normally people go by. They don't even think of changing the audio settings. It's worth investigating how to change that and how to have a little bit more control over the kind of frequencies that you can leave out or leave in. Whether if you're going to be using music, the range of frequencies is going to be broader than if we're just talking. So that's something to have into consideration. I just won't go into it right now, but there are a few. If you just Google best way of using music through the Zoom, you can get a lot of really good ideas of how to maximize the sound through your Zoom. Yeah.
Thanks, Tanya. That's really helpful. So Kumari's asked a question: are there any apps you can use in the context of counselling children?
Ooh.
Any particular, presuming that's maybe music apps or anything to do with songs?
I'm not using any. Jeanette, are you using any apps, any particular apps?
No, not at the moment. I think what we've been trialing online platform for Teams. So we've been using Microsoft Teams for our music therapy groups and trialing that this week, and it's been quite successful. So I should address the apps question first. So no, there are not the one any that I particularly use in sessions. I'm probably aware that there might be music therapists who would use particular ones, maybe in if they're using instrumental learning as a form of therapy with clients. They might use particular apps, but I'm not aware of which ones they might use.
Another question from Ada. Are there any particular resources you might recommend for practitioners to develop skills or use in session or for clients? I know you've both mentioned some already. You mentioned different, but any other resources that you might have?
Can you specify what sort of practitioner we're talking about?
Ada, do you want to unmute and answer that?
Yeah, so I'm a psychologist, but you know, for those of us who are very green and new in this area, are there any resources that you feel would be a really good grounding for us, either to sort of develop our own knowledge of the area and applications, or even just to refer clients who might want to understand a little bit more about the role of music therapy?
Well, I think music listening and sharing the music and doing a little bit of sharing the stories behind the music that the client might select could be a starting point. If you're a psychologist, you would know it can evoke quite strong emotions and quite strong responses. So you just have to have in mind that you have the systems in place to be able to support them properly. It depends on the fragility of the person you're talking to or with. So that there are considerations that you have to have. But bearing in mind what I said before is that everybody has got some sort of a relationship with music, and so you can capitalize on that. Just draw from what they already have in the library of sound, in the history of music, and just see if we can draw some of those tastes, preferences, likes or dislikes, and see if you can use that as a point of conversation and go delving deeper into whatever they're going through. What do you reckon, Jeanette? Have you got something you'd like to say?
Yes, sorry. Well, you're just reminding me of a few things. There's a music therapist, Carmen Chong Clinch, who there's a site called, and I'm just looking it up now. Sorry, just bear with me while I
She was very big in making playlists, isn't she?
Yep. It's called Tune Your Mood, so tuneyourmood.com, using music positively to help young people tune your mood. So, and I know she has used this this work. I can't remember if it's an app, a music-based. Sorry, and I'm looking at this on my phone, so it's not the greatest of visual look here. A music-based e-platform situated in an award-winning youth health portal, Tune In Not Out. So that's the actual portal. Tune In Not Out, all one word. And you might find some useful resources there. I think there's a couple of PDFs about and fact sheets about using music listening in relation to mental health, because it's important to remember that also music listening, particularly for vulnerable people such as our adolescents, or particularly with adults, young adults and older adults with mental health concerns, that sometimes music listening can take you to places that are not appropriate and that are uncomfortable, but leave you with a prolonged sense of feeling uncomfortable. And there are the times that people often think that music's always safe to use. Well, there are times when music may not be safe for everyone to use. And if we have sometimes some of the patients or the clients that I've worked with in both with adults and with adolescents, when they're constantly listening to music that keeps them in a more depressed, unhappy state, then we need to look at why they're listening to that music. And sometimes the music is actually able to lift them out of that state, but when they're constantly listening to it and it keeps them there, then it's an unhealthy. That's like a healthy and unhealthy ways of using music. So that's one. I might keep looking and seeing if there's something else I can find.
Thanks, Jeanette and Tanya, for addressing that question. I think that probably covers another question, and there's a few others I'll come back to, but I work with vulnerable groups of teenagers. How might you engage young people with creative therapies if they don't identify as being creative or artistic? And I think using a link like what you've just suggested might be good. Is there anything else you'd add to that particularly?
What's your position as a worker? Sorry.
That's Laura.
Hi, I'm a youth worker, and I'm working particularly with Aboriginal teenagers, young people in Redfern.
Yeah, okay. And are you hands-on with them now, or just through online platforms?
At the moment, just through online platforms, but normally face-to-face.
Yeah. Yeah, I mean, that is a cohort of people that are very much into creating their own songs too. And well, from my experience anyway, there seems to be a musicality that runs in quite deeply, and they engage well with songwriters, and maybe songwriting, movement to music. They're very embodied too. So, well, that's the kind of the Indigenous people that I've been working with in Logan. That's what I sense. It's very much about taking them into their own bodies and allowing their bodies to be like a point of expression. Music is not just a cognitive thing. It has to be very embodied. So ways that you can facilitate that. Well, I don't know whether if you're seeing them like in groups or just one-on-ones, but again, I think if without you being present and face-to-face and being able to respond in a more immediate way, having the screen sort of in between you, you have to be careful of how to use these considerations that just Jeanette was saying. But I think if they're in charge of the music, they want to listen, and they get to share that, and they get to move to that, and they get to maybe do song parodies with it, change the lyrics to a song that they are feeling very connected to, something that feels like it's their story that they're telling, not somebody else's story. Things like that. I think you can use that pretty safely. Yeah. Do you have anything you'd like to add, Jeanette?
No, other than that, I think that initial point of connection is about them feeling comfortable with you about sharing something that's very personal. So are they teenagers? Yeah. So teens, and being a mother of teens, music is a very powerful medium, and something that's very personal to a teenager. They hold their music very close to them, and I'm not talking about physically close to them, also just about personally close to them. So to them actually to take that step forward and say, when you're inviting them to, I thought we might just share a song between each other about, this is what a song that I really like and this is why I like it. Can you tell me about a song? Can you play a song for me on your phone or whatever it is, via YouTube, and tell me a little bit about what you like about that song. It lets you into that little window, and may start to tell you something a little bit about themselves. But it's a very, very powerful medium for a teen to be using.
Another thing that you could do also with teenagers, they could engage with wanting to create, like, have a sense of a band. I don't know whether you have got the logistics of it, but even a simple recording platform could do like something. If you've got GarageBand or something like that, and you get to send a song, and then everybody gets to record themselves on top, a little bit like what the couch choirs are doing. Yeah, you cannot do that live. It's very hard to use a live platform like Zoom or something because of the delay. But if people send themselves recorded, whether it's video or audio, then somebody will have to do the editing. But that could be a good way of them staying connected, staying as a group, doing their own little bands. And maybe if there's 20 of them, they could do 5 different songs and have 5 groups or something like that. You could just be creative with how you put them together, and then I don't know, you could create a song competition or a song showcase or something like that. Like that, it could develop into all sorts of programs after that.
Excellent suggestions. We just got, excuse me, 2 more questions. One of them I think you probably already answered just in what you've both been saying there, but what platforms or methods would you recommend for online choirs? With the lag, I imagine it's difficult to sing together in real time, as you've just said. Yes, it's almost impossible. Have you any suggestions through apps or processes? So you've mentioned couch choir and is it GarageBand?
Yeah, well, GarageBand is a default program that comes with Mac computers. There's others that can be used, like Logic Pro. Like I'm a Mac user, so that's the kind of the language that I know how to use properly. Look, I don't think there is a good platform that is that you can use for live music. I think all of these couch choirs, it's all, you know, individual recordings, individual video footage that has been sent, and somebody has spent a lot of time editing it and looking at it as if it was a Zoom session, but it's not so. It's actually quite labor intensive. But if somebody can take that on, it could be a very interesting little program to do, and that could be part of the process, part of the, whether you want to call it therapeutic process or just a collaborative creative process. Yeah. That's what I know so far. I still feel that I'm very like a baby on nappies with all the telehealth stuff. I'm still learning myself, but that's what I've come to understand from listening to different webinars, that it is not possible to do live music in a satisfying way through the online platforms. Yeah, it has to be pre-recorded, and edited together. Yeah.
All right. Thanks, Tanya. And just our last question. And
sorry,
Jeanette,
Jackie,
sorry, yes?
Can I just add something on to Tanya's, if that's
Yeah.
all right? Just that it is challenging to do live music via an online platform, and it's often that we're not going to get the same kind of experience as if we were in the room there face to face with everyone. But there are ways of sometimes modifying and even just using things like muting. Using your mute buttons. So with my online music therapy group, so they're with parents and children, and we did a trial this week, and on a whole, the parents said it went quite well, and they just recommended that when we were all singing together and all playing instruments together, for everyone to be able to, for each family to be able to hear what I was doing, they needed to mute.
Yeah.
So then they said even though then that meant they couldn't always hear, of course, couldn't hear what others were doing, they were able in their own lounge rooms, their living rooms, to be able to engage much more easily when they could hear. So sound is a big thing, but by muting, that makes a big difference.
Fantastic suggestion. Thanks, Jeanette. And our last question is from Alicia. How would you suggest starting music with a client who has suffered from trauma?
Oh, over to you, Tanya.
Oh,
that's a small question to finish with.
Over to you, and then I can add in a little bit from the family end, I think, in the hospital setting. So, yeah.
Look, there's it can be tricky. Sometimes music is the first thing that comes. Sometimes you may. I work with trauma. I work with kids with trauma, domestic violence, sexual abuse. Sometimes music is the most immediate thing. Sometimes it takes 5 months for them to even engage with music. So each person is a world in themselves. You need to just be very sensitive to where they are at. And what I would say is not to ever impose anything. You can only offer. And from the offering, if things come flowing gently, then you can pursue that. If they indicate that that's not where they want to go, well, you have to have other resources under your belt. And I guess that's where I feel very fortunate that I'm a music therapist and a creative arts therapist. So I have a whole modality, a range of modalities that I can use as a way of interacting with a person. Yes, everything that we have spoken about before applies to trauma, especially like the sensitivities, the considerations that we have to have for the safety of the person. And as I said, some people may go straight there and that's going to be their place of refuge. As Jeanette said, it could even be not only a place of refuge, but also a place of perpetuating their sense of unsafety or the sense of whatever they're going through. So, well, I guess it would be great if you had some training with how to use music. I cannot really give you many tips like that because we're dealing with people that have been severely wounded if they've been traumatized, and these traumas present in many different ways, and there's not one size that fits all at all. You have to have a whole range of deep understanding of how to use these sensitively.
Jeanette, did you want to add anything just in the last few minutes?
Just in my experience in working with children who are hospitalised, and if it's been a result of a traumatic accident, then sometimes when they're in and this is perhaps a different kind of way of working in a different kind of setting to the experiences that Tanya has had. So in that hospital setting, we often do a lot of work with families. So we'll connect with them in helping them to find a connection back with their child. So that's one of the most important things in a hospital environment, which is not a normal environment. And we will use music listening, preparing playlists very carefully about the selection of songs, the types of songs, and doing some songwriting with parent and child as well too.
Lovely. Thank you both very much. I know we're all deeply appreciative of your time and your generosity in being here with us today, both Tanya and Jeanette. I know you're busy with other work projects, so it's really great to have you on today and to be able to have your expertise shared. And I'd like to invite everybody, as we say farewell to Tanya and Jeanette, to do something with your hands that expresses your thanks to them for today. So whatever that might be, could I get you to... So that's everybody saying goodbye in their own ways to you. So thank you both for being here today, and look forward to seeing you soon in other contexts.
It's been a pleasure. Thank you, Jackie, and thank you, Tanya, and enjoy the rest of the webinar, everyone.
Thank you. Thank you, guys.
Thank you.
Bye.
Excellent. Elise, was there one particular thing that stood out for you?
Hey. Sorry, unmute myself. I think the importance of music in evoking emotion was really highlighted, and just the practical idea of playing a song, both myself and having the student play a song as well, and discussing that as well, I think could be really powerful. So yeah.
Lovely. Yeah, great. Thank you. Thank you all for taking that opportunity to check in with a one or two or three other people. We're going to have a little bit more time in those small groups in about 10 or 15 minutes to think about protective factors, which is what I'd like to move into now, to think about and to share with you some of my reflections on this time in isolation. So as we come back into the room, if I could get you to all mute yourself again. It's great you've been able to unmute for our conversations, but we'll just all get on mute again, and then we'll have a really good sound quality for this last piece as well. So we've got about 35 minutes to go before we finish up. So what I wanted to share was 3 events that I've had in my life that have been challenging, and like all of us, we've all had different challenges that we've had to come to terms with, and the fact that we're all still here suggests we survived those, and hopefully that we're made stronger by some of those challenges that we've met in our own lives. I know the 3 events that I'd like to share certainly have made me stronger, but were difficult at the time. And I think since this time of being in isolation, and it's been about 5 weeks for me so far, I've gone through different stages of it, and some of it have felt very productive, and I've felt like I've really risen to the challenge in some ways of what this time has offered. But some of it's also been really tough and hasn't been so productive emotionally or kind of in a work sense. And what it reminds me of are 3 events in my life. And there's particular elements of how I'm feeling and what I'm experiencing now that conjure up those experiences. And the first was when I was 25 and I travelled to India. I'd been there a couple of times before, and when I finished my psych degree and when I got registered, so I worked for 3 years after that and got my ticket to register as a psych in Sydney, I knew I wanted to go back to Varanasi, and I bought myself a ticket and spent 5 months there, and then another couple of months traveling around the country. And I think what was challenging, there were many challenging things about being there on my own when I was 25, but what I was most worried about was getting sick. I found an apartment to rent, and I was living in a small community, and I only had 1 or 2 friends that I knew before who were living in that area, a lot of expat students who were studying there, studying music and dance. And that's something that I'd wanted to do. So I took that opportunity to do that. But I was really worried about getting sick, and a lot of people were sick around me. A friend I made there ended up with tuberculosis, another friend had hepatitis. And so there were some pretty serious kind of infections that you could get. And so one of the things that I used to do when I shopped daily, because I didn't have a fridge, was to wash my fruit and vegetable incredibly carefully, to only drink bottled water, to remember to keep my mouth shut in the shower. So all of those things I had to learn so I didn't get sick. So even though daily living was harder and it took me longer, I learned that I could adapt in those situations. And it sort of reminds me a bit of that now, because I'm also worried about getting sick, and I'm worried about people around me being unwell. So I have to be so much more careful with my own hygiene. And I think remembering back to that time has helped me with some of the behaviours I have to change now to reduce the risk of illness. A second thing I wanted to share, a second challenging time, was doing a Vipassana meditation course. I don't know if any of you have done any of these. I highly recommend them to most people, but not all. They're 10-day silent Buddhist retreats, and I've done 2 of them in the Blue Mountains in Sydney, and they've both been life-changing experiences, but also incredibly difficult. I think I'm probably more introverted than extroverted, so I thought, oh, it won't be that hard to not talk to anybody for 10 days. But after day 2, on both occasions, I felt like I was going crazy and was asking myself, why on earth did I choose this when I could have done so many other things with 10 days in my life? And one of the hardest things about being in that isolation was being close to people, but actually not being able to contact people. So not only could I not talk to people, but the noble silence that we'd committed to meant that I couldn't have eye contact, that I couldn't communicate in other ways to people. And I found this really challenging. And one of the things I found challenging about it was that I realized that a big part of my identity was to be in helpful contact with other people. So I found myself doing all these weird things, like at the end of a meal break, it was in the middle of winter when I did one of them, so it's quite cold, so they shut the doors to the dining room, and they were big, heavy doors. And I found myself, as I was leaving the dining room, having the door a little bit ajar and waiting for the next person so I could help them with them not having to open the door. So these were kind of random attempts that I made to communicate and be helpful to others. And when I saw that pattern in myself, I realized how big a part of myself that was. And I sort of thought that, gosh, if I can't be helpful, maybe I won't even exist. So I went into this kind of big question about who am I really and what's my purpose. And so I really learned a lot about myself and what I could be in a helping role, and also being able to exist without being necessarily helpful to others. So that challenge of isolation taught me a lot about what I need to do to communicate effectively to others and how I can stay in contact, but also how I can go into a deeper place of self-sustaining mode internally. That could also really help me and give me a lot of insight about myself. The third challenging, and these are by no means the only challenging situations that I've been in, but the ones that for me bring up most resonance with what I'm experiencing now as challenge, is having the loss of my grandparents. So I lost my grandfather first in my early 30s, and I lost my grandmother in my late 40s. And I was very, very close to both of them. And one of the coping strategies that I have in difficult times is to throw myself into work. So when my grandfather died, I was already working 2 part-time jobs. I picked up 2 additional part-time jobs, and I was working about probably, 80, 90 hours a week, which is a bit ridiculous. But it felt like if I could just be productive and busy, then I wouldn't have to cope with the sadness and the loss that I was feeling. And I really noticed myself doing the same thing this time around as well. So as soon as I knew we'd be in lockdown, I just mobilized and I started getting really busy and productive, and I've been working really hard. And in the last 2 weeks, I've sort of backed off thinking, I can't sustain this pace. I don't know how long we're going to be in lockdown, but I've actually got to pull back and do other things. And I don't by any means suggest that I only cope effectively in difficult times. There's lots of unproductive behaviours I've engaged in as well. And I think overworking for me is really an unproductive behaviour longer term. And certainly that time in India, I comfort ate so much that I couldn't fit into any of my Western clothes when I put them back on after getting out of my salwar kameezes, which had lovely effective drawstrings. So I was pretty safe for those few months. And my sister, when I met her in the airport in Istanbul, didn't even recognize me. I was so big. So there's lots of things that I also do that are not so productive. But what I did learn from those 3 situations of challenge, living alone in India at 25, being in silence on a 10-day retreat, and losing my grandparents, was that even in hard times, there are things that I do that help. There are protective factors that I've learned now are coping strategies for me that are successful, that can resource me for the difficult times. And what I'd like you to reflect on is one life event, and you don't have to share this in your small groups that I'm about to put you in, but one life event that's given you some resilience, some protective capacity that you know works for you now, or can be better mobilized to work even better for you now. You don't have to share that experience, but I want you to share that resource that you feel like you've learned. Some sort of resilient capacity that can help you now. And if you can do this for yourself, you're also getting a sense of how you can use this, if you're not already, for those around you, family, friends, and clients or students that you might be working with as well. So being able to identify protective factors can come from reflecting on other life challenges and seeing where we've worked well in those sort of situations. Reflecting on your own challenge maybe, and some protective factors that have come out of that, and then hearing some others as well. What were some benefits in that exercise for you? I'm just typing that in the chat box there, and I'll read some of those out just as we're muting again and just preparing to finish up for today. Importance of self-kindness, how critical at this time. Going into self and being true to one's own values, that's lovely too, thank you. That was from Greg. And from Jill, routines are important, and so is checking in with our values daily and meditation. Thanks, Jill. And Kim, some of my protective factors are connecting with nature, walking, catching up with trusted friends often. Lovely, thanks, Kim. Melissa, knowing that only I truly know what's right for me. How true at this time. I think we're really separating the wheat from the chaff in terms of what we know is going to be valuable. We're hearing lots of messages, and what we're trying to provide, I guess, in this platform is opportunities to learn more and to tap into some resources that can be helpful for us and others, but we really do need to check that it's right and it's timely for us and others. So some lovely things, having gratitude, holding gratitude, practicing that, discussing how strength, resilience and independence will develop further as a result of difficult situations. Really lovely to be able to hold on to all of that stuff. So thank you for sharing all of that. We're going to start to wind up now, but we have some prizes that we'd like to offer one person as we start to finish up here. And I just want to show you what they are, and we can have that competition. Now we've done some games in the previous weeks, and we're doing something very different today, given that it is a music wellness focus today. So our fun and prize session, one person who's going to be the winner of this will win 2 things. They win a gift certificate with a fabulous music and singing teacher, Claire Hewson. She's actually a good friend of mine, and she's doing online work at the moment. So somebody will win a 45-minute session with Claire, and they're her details that you'll get. And all these slides are up on the website if you want to access them further also. Additionally, you'll win 1 free live webinar. We've got lots coming up, but these are the 3 most immediately coming up. We've got a great one in a couple of weeks on Friday, Not Another Icebreaker, looking at 10 activities for doing group work, including online. I'm doing the Sandplay Therapy, Not Just for Children webinar again, coming up in a couple of weeks. And we've got a 3-part series on an introduction to narrative therapy. So the first of those is coming up on the 20th of May. You had a brains trust there. That was lucky.
That's right, I did. I had a little bit.
Well done.
Thank you very much, Jackie. I enjoyed that. It was good.
That's okay, pleasure. And thanks to all for playing. I just wanted to let you know of what we've got coming up next week. Last week I asked you what you might be interested in doing further. And one of the things that was very, very popular was having an opportunity to do some mindfulness meditation. So that's going to be our focus next week. We have Margie, who's one of our trainers with us, who does our workshops, and she's going to be running some in the next couple of weeks as well. But she's going to be our feature guest next Thursday. It's going to be a little bit later next week, and we're trying to accommodate as many different time zones as we can. Australia's a big place, and we want to encourage a few more of our WA friends to come along, and that time might be a little bit more suitable for them. So it's 11 to 12:30 next Thursday, and I hope you can register and join us then. So thank you very much for coming today, and I'll let you all unmute your microphones, and so we can all say a big goodbye together. So lovely to see you. Thank you for being here today, and look forward to seeing you next time.
Thanks, everyone.
Thanks
Bye.
for everyone. Bye-bye.
Bye.
Bye.